We do not pee from our vagina. Oh. We don't pee from our vagina. Actually, we have Hello guys, welcome back to my channel. I hope you're fine and you're doing very good. If this is not your first time on my channel, of course, you know you're always welcome to my channel. And if this is your first time, trust me, you're going to love my channel. And please, as usual, don't forget to subscribe to my channel if you've not, and if you're already a subscriber, always like my videos and share my videos. I'm going to be talking about female hygiene, just in general, like how women should take care of themselves, you know, especially down there. Let's get on. I have like I wrote down like 10 important tips all women should know and follow. Okay, let's just get started. First of all, before anything, we need to understand what hygiene is. So like hygiene is just like, the practice you do to maintain good health and prevent diseases, especially through what? Cleanliness. So that's basically what hygiene is. So the very first point I'm going to give you here is about, we have to start from talking about menstrual products, like the types of menstrual products and how to use menstrual products. We already know that women every month, of course, unless you're not pregnant, we see our menses or period. Like it varies between 3 to 7 days depending on your cycle. And the products you use: pad, tampons, menstrual cups, and so on and so forth. So okay, let's start from pad. It's advisable for you to use your menstrual pad like 6 to 8 hours before you change it. So like in a day, you should be able to change your pad at least 3 to 4 times in a day, of course depending on your flow. But if you have heavy flow, of course you have to change more times than people with normal flow. And why is it important to change this pad? Because if you wear like the same pad for a long time, it could easily, like when the blood dries up, it could start growing bacteria, and those bacteria could easily spread into your vagina, and I mean nobody wants that. So that's why it's always advisable to change your pads as often as possible. And when it comes to tampons, you should change your tampons like 4 to 6 hours. Reason: to prevent toxic shock syndrome. If you're getting a tampon, don't get a tampon that has a very high absorbency, because if it absorbs very fast, it could lead to toxic shock syndrome. And if you wear your tampon in for a very long time, it could also lead to toxic shock syndrome. Toxic shock syndrome is just caused by a bacteria like Streptococcus bacteria or Staphylococcus aureus bacteria. And normally, naturally, we have Streptococcus in our vagina, like the natural flora. But then, when you wear the tampon in for a very long time, it could become pathogenic, and that is when it can cause the toxic shock syndrome. So, the second point, usually, I know all of you have seen this so many times and so many places. Wear cotton underwears because it allows fresh air. It allows fresh air to pass through, because if it's stuffy down there, that could also lead to growth of pathogenic bacteria. So that's the reason why you need cotton underwear. Now we're going to point number 3. The third point, this one, I'm sure most of you already do this. Like this one is like, in every woman's purse, what should you see inside every woman's purse? Number 1, of course, a pad or a tampon, depending on what you use. Number 2, a tissue should always be in a woman's purse. Number 3, a wipe should always be there, hand sanitizer, and then any other thing you want will be there. Because truth is, sometimes your period can surprise you, so it's always good to have a pad. And even if it's not for you, for a sister or for someone when you're outside. And of course the tissue paper, because I mean when you use the toilet, when you ease yourself, you would need a tissue. Because now I'm getting to this point. After peeing or easing yourself, or you, it's always that, of course, I mean, I feel like everyone does that. You should always wipe yourself, and you have to wipe from the front to the back. Reason, if you wipe from the back to the front, that means you're going from your anus into your vagina, and you know, from the anus, that's your digestive tract. It means that there are a lot of bacteria that already grow in your anus, and if you wipe from the back to the front, that also, you can spread bacteria from your anus into your vagina and your urethra. So that's the reason why you have to always wipe from the front to the back. And yeah, this brings me to another point. Some people think that we only have one hole and we pee from our vagina. Please, please, and please, we do not pee from our vagina. We don't pee from our vagina. Actually, we have in our external genitalia, there are two different holes: our vaginal hole and urethra hole. So please, we don't pee from our vagina, we pee from our urethra, which is just, don't worry, it's anatomy. I don't want to go too deep. I'm about to talk about the fourth point, on how to keep your vagina clean and how to wash it. Trust me, you don't need soap. You know, using all these products, soap, this one, that one, you don't need it. Trust me, you don't. Water is enough. I'm telling you, just warm water when you're having your bath. Just warm water is very much enough to wash. And of course, when you're washing, just make sure you clean the sides of your vulva very well. The vulva, the external part of your external genitalia. So just because the vagina it just cleans itself. You don't need to insert anything. You don't need to chook and wash. It just cleans itself. So you just need water to clean the external part, and that is it. Even if you want to use soap and all that, just don't go for soaps that have like very strong scents or very harsh soap. Just go for like mild soap, soaps with like minimal scent if you want to use soap. But I would advise you not to use soap. But even if you want to use soap, just don't use soap with like harsh scent. Just go for minimal scented soaps. Reason, because if you use so much soap here, I mean, all this soap, like harsh soap, can easily change the pH of your vagina. It can change it can disbalance your pH, first of all. Secondly, it can also, of course, when the pH changes, because naturally we have bacteria in our vagina, but don't worry, it's just the normal microflora, like the normal bacteria. It is not pathogenic. It does not give problem. It just cleanses and protects your vagina from infections and all. So, but then when you start using like harsh soaps and all, that's when the pH can change. And when there's change of pH, it means that you're allowing growth of unhealthy bacteria in your vagina. That means other bacteria can easily grow, like unhealthy bacteria can start thriving in your vagina, and that's when it will now become pathogenic. That's when you can now start having infections or like bacterial vaginosis, for example. Like that's like the most common form of like infection when it's changing the bacterial microflora. So the fifth point, always practice safe sex. It's very important. You know, prevention, they say, is better than cure. So it's just always better to practice safe sex, you know, to prevent sexually transmitted infections or diseases. And the sixth point, see, after all these things, it still boils down to eat healthy. You know, for women, we need like natural microflora, yeah, for our vagina to thrive and be healthy. So you could, trust me, it's about healthy eating. A lot of fruits, a lot of vegetables and all that. And another thing, you could also take yogurt, like just go for the natural yogurt, like natural yogurt, because natural yogurts contain probiotics, a lot of probiotics that helps your vagina natural microflora. Yeah. The next point is douching. It still boils down to the same thing I already said previously. You don't need to do too much to keep your vagina clean. You don't need to douche, because that douching still changes your, because I mean a lot of douche contains a lot of chemicals, harsh, whatever. So you don't need to do that. Don't douche, because douching is still going to change your pH, still going to change your microflora. So it is not necessary to douche. Water alone or mild soap is very much enough to clean your vagina. No douching, please. Okay, that said, next thing, have your bath. Always make sure you have your bath at least 2 times a day. I know some people are lazy to do that, but if you cannot afford to have your bath 2 times a day, then try once. If you cannot do 2 times, at least once a day. At least once a day. Oh my god, at least try as much as possible to have your bath once a day. Then if you can do 2, perfect, very good, have your bath 2 times a day. But if you can't have your bath 2 times a day, then at least try as much as possible to have your bath once a day. Okay, for the 9th one, yeah, the moment you start seeing your menses, try as much as possible to visit a gynecologist once every year. It's very important. Once you're seeing your menses, whether you're sexually active or not, you need a checkup. You need a checkup at least once every year. Once every year, you should visit a gynecologist, sexually active or not. And for those that are sexually active, then you have to do pap smear at least once in 3 years, especially if you're like below 50, or no, let's say below 45 years. Once every 3 years. No, even 45 years is not too much. Like, I think maybe below 30 or 35 years, you should be doing your pap smear once in 3 years. Then past 35 or 40, it can now be every year. Once every year you do your pap smear. It's very important. Another thing I want to add is as a lady, you need to get your HPV vaccine, human papilloma virus vaccine. You need to get the vaccine. It's very important, because it's more like HPV vaccine can prevent or prophylax cervical cancer. That's why it's very important to get HPV vaccine. Of course, whether you're sexually active or not, you should get your HPV vaccine. If you've not gotten yours, try as much as possible to start. It's just 2 doses or 3 doses depending on your age. Just 2 or 3 doses depending on your age. So in 5 months or 6 months, you're done taking all the vaccines. So the earlier you start getting it, the better. So the last one, oh my god, you should always know your vaginal discharge. You should know your normal vaginal discharge. So just in case there is like a change, you would know. Or if there's a change in both the smell, the texture, the color, you should know. And once you see a change, the very first thing you should do is, of course, visit a gynecologist. I'm going to tell you a few diseases that cause change in the texture, color, and smell of the vaginal discharge. We have to start with the most common, which is bacterial vaginosis. When you have BV, the discharge odor, it will have like a fishy smell. But if you have BV, of course, the first thing you have to do is go to the hospital, because you need to take antibiotics and, of course, probiotics. The second one is Trichomonas vaginalis. That one is sexually transmitted infection. It has like a very pungent and purulent odor, and it has a yellow. It's yellow. Your discharge would be yellow, and it has a very strong and purulent smell. So visit a gynecologist. And another one is when there's a yellow. When you also see a yellow discharge, but it doesn't have odor. But maybe you could have like urinary incontinence and all, then that could be gonorrhea. Make sure you take care of yourself. It's very important. As ladies, we should always take care of ourselves. We need to take care of ourselves, you know. Just take care of yourself, be of good health. It's important. So that's it though. I've shared everything I have to tell you concerning female hygiene. I actually hope you watch this video to this point, because trust me, all those points are very important. So please don't forget to like this video. See my hand. Please don't forget to like this video. Subscribe to my channel if you've not subscribed to my channel. It will not take anything to just click it. And please subscribe to my channel. You can even put in hit that notification bell, so that anytime I drop a video, you'll be the first to know. And comment down if you have more things to add. Like if there's anything you have to add about female hygiene that I didn't say, please feel free to comment down and add your own point. Or if you have any question, comment down to ask me anything. I'm open to questions, and I'm also open to suggestions. So that's it. See you guys next time. Bye.